the computer. All right. So we'll begin now with all our participants that are here. Thank you for joining us tonight for another OPAC monthly presentation. And we have Katie and Julia here, who are clinical dietitians at Sick Kids, and they're here to present on nutrition for children with cancer. If you'd like Katie and Julia to introduce yourselves, and just real quick to let everybody know, I am recording the session, so if you don't want to be on camera, you can keep your camera off. We'll have time for a Q&A at the end, and there's also a live chat that you can communicate with during the presentation. So that being said, Katie and Julia, if you'd like to begin, let me know when to move the slides and we can go from there.
Perfect. Thank you. So my name is Julia, and I'm a dietitian at Sick Kids with Katie. I work in 8A, which is the inpatient oncology and hematology unit. And thank you everyone for having us. We're both really excited to present today.
Yes, thanks, Julia. So my name is Katie. I am the dietitian in the bone marrow transplant unit at Sick Kids. Yeah, and welcome. We're excited to get started with you guys. So today we'll be presenting enhancing nutrition on children with cancer. And also we just wanted to mention at the start as well, feel free to jump in at any point. It can be interactive and informal. So whether you turn your mics on or pop a question in the chat, either works. But yeah, we can get started. Next slide, please. So the agenda of what we'll be going over today, we'll start with an overview of nutrition in childhood cancer, and then we'll go through some common nutritional challenges and strategies to address them, nutrition therapy options, nutrition myths and nutrition facts, creative tips for fostering good nutrition during treatment, and then we'll end with a question and answer period. So to start, we'll go over the nutrition kind of basics in children with cancer. So why is nutrition important in children with cancer? So first off, for continued growth and development, it's also known for good nutrition to improve tolerance and response to treatment, as well as improved recovery from treatment, decreased complications and infections, decreased length of stay in hospital, as well as reduced cost of care, and improved quality of life. So there are some common barriers to achieving optimal nutrition in children with cancer. I'm sure some of you may be aware of these already. The first is reduced oral intake. So that's quite common in children with cancer, and it can be due to a variety of factors such as anorexia associated with the diagnosis, fatigue, decreased appetite, and early satiety. And then there's also effects of cancer treatment and those side effects, and those can be barriers to optimal nutrition as well. And so those can include mucositis, taste changes, nausea and vomiting, dysphagia, diarrhea, and we'll get into more specifics of those barriers and strategies to overcome them in future slides as well. And lastly, there's psychosocial factors. So things like depression, loss of control, change to routine, and food aversions. And so all of those can create barriers to achieving optimal nutrition in children with cancer. So the general kind of focus for nutrition in childhood cancer, the kind of primary goal is to meet energy, macronutrient, and micronutrient requirements to support growth, development, and recovery. And we'll get kind of more into the details of macronutrients and micronutrients as well. Typically, we focus on a high protein, high energy foods diet, as well as a varied diet that's based on Canada's Food Guide. We also want to ensure adequate delivery of micronutrients that can be affected by cancer treatment, as well as to manage and overcome some nutritional challenges and symptoms of cancer treatment as well. So starting with the basics here. So we have our macronutrients and our micronutrients. And macronutrients include your protein, your carbohydrates, and your fat. And so to create kind of a balanced plate, having all three macronutrients present with each meal is really important and a good starter to building a balanced plate. And so if you look at the diagram on the right-hand side there, this is from Canada's Food Guide, and so they do recommend for half of the plate to ideally be fruits and vegetables, a quarter of the plate to be protein foods, and a quarter to be whole grain foods. And then water ideally would be the drink of choice. And I just want to mention that you can include fats with this as well. There are fats in protein foods, and we often cook with fats, but adding additional fats, healthy fats to your plate as well, is a great part of building a balanced plate. And next, there's the micronutrients. So that's kind of all of our vitamins and minerals. So we'll discuss some of them in more detail today, and we'll highlight calcium and vitamin D, potassium, magnesium, and phosphate, as well as carnitine. Next slide, please. Thank you. So getting kind of more into the details of macronutrients. First off, we'll start with protein. The primary function of protein in the body is to grow, build, and repair tissues, as well as to protect lean body mass. And lean body mass is your muscle mass. So great sources of protein include any meat, poultry, fish, eggs, dairy products, legumes such as beans, lentils, chickpeas, as well as soy, which can be tofu, tempeh, edamame, things like that. And then there's carbohydrates. So carbohydrates are your primary energy source. So carbohydrates are the body's preferred source of energy. And there's many sources of carbohydrates. Some of those include fruits and vegetables, as well as whole grains. And then lastly, there's fat. So the primary function of dietary fat is to store energy, protect the organs, make hormones, and absorb fat-soluble vitamins. And some good examples of healthy fats include fatty fish, avocado, nuts and seeds, as well as vegetable oils. These are all sources of unsaturated fat. There's also other sources of fat, such as saturated fat, and that's more from animal products, so meat as well as dairy products and whatnot. But yeah, those are kind of the main details of the macros, and now we'll jump into the micronutrients.
Thanks, Katie. So I'm going to be talking about the micronutrients, and we reviewed the macronutrients, which an easier way to remember them is macro is big, so our body needs larger amounts of them. And we're diving into the micronutrients, which means small. So our body does require micronutrients, but in smaller amounts than it would macronutrients. So we're going to talk about calcium and vitamin D, which are important for bone health, as well as the electrolytes, potassium, magnesium, and phosphate, which the body needs more of during treatment. We did mention carnitine, which we can talk about if we have more detail, but we thought this was a lot of nutrition 101. So if we have time at the end, we can definitely talk about carnitine if anyone's interested. So for calcium, many of you are probably familiar with calcium. Its main function is building our strong bones and teeth. It's especially important for children because they're still building bone mass up until about age 25. It also helps with nerve and muscle function, including your heartbeat. So some sources, dairy products, which is probably the most common source that we hear about, as well as calcium fortified plant-based options and canned sardines and salmon, tofu prepared with calcium, as well as sesame seeds and tahini. I highlight here that plant-based alternatives aren't all created equally. So although dairy products from, for example, cow's milk are all high in calcium, not all plant-based options are, but you can always double check the label to see which has the highest amount of calcium. And next we have vitamin D. So we have the sun there because it's known as the sunshine vitamin. And the function of vitamin D, it works alongside calcium to help absorb and transport calcium in the body. So that's why both of them are important for bone health. And it also helps keep our immune system healthy, as it plays an important role in our immunity. The sources of vitamin D, our main source is actually sunshine. So in Canada, often we're very deficient in vitamin D in the winter if we're not getting enough sun. So there are food sources such as fortified milk and plant beverages, fortified margarine, fatty fish, eggs, organ meat, and fish liver oil. And you can also talk to your child's healthcare team if you are concerned about their vitamin D intake if they're not getting a lot of sun, which not many of us are during the winter. So this would be something that you could talk about, because many Canadians do need a vitamin D supplement during the winter months. Then we have potassium. So this is our first electrolyte that we'll talk about. So the functions of potassium are to help control our blood pressure, as well as helping with nerve and muscle function, also including our heart contraction. So we often think of bananas, but I always like to highlight that potatoes have just as much, if not more, potassium than a banana. So there's lots of different sources of potassium, mostly in fruits and vegetables, as well as legumes, dairy products, nuts, and seeds. I also like to highlight chocolate on this slide and molasses. And then we have magnesium, which is another electrolyte. So it helps our body use energy from food to make new protein. And it's an important part of bones and teeth, keeping our muscles and nerves healthy as well. And we have some sources at the bottom there. So green leafy vegetables, high fiber grains, legumes, nuts and seeds, and milk and dairy products. And the last electrolyte is phosphate. So it works alongside calcium as well, in addition to other nutrients to help build our bones and teeth, as well as it helps our body to use energy and supports growth. So we have some sources here as well, lots of different sources, and you'll notice a lot of them overlap. So edamame, potatoes, mushrooms, whole wheat, oatmeal, quinoa, yogurt, organ meat, fish, lentils, chickpeas and legumes, eggs, pumpkin seeds, sunflower seeds, cashews, tahini, and my favorite, chocolate. And with the electrolytes as well, I should highlight the reason that we're talking about these is because for many kids undergoing cancer treatment, their bodies need a little bit more than they would otherwise, because the treatment increases our need for these electrolytes. And we discussed, Katie mentioned a high energy, high protein diet. This is often recommended for children undergoing treatment when it is difficult to eat enough food to meet their energy requirements and their protein requirements. So the purpose of the diet is to support growth and a healthy body weight, as well as these high energy, high protein foods are high in calories and protein, as well as overall nutrition, but in a smaller volume. And the key here is that we're trying to make every bite count. So they're really dense sources that can be a little bit easier to get enough without having a huge volume of food. So the strategies here are to provide the highest energy foods first. So I like this visual on the side. It just helps to kind of see what are the highest energy foods that you can start with. And then you can absolutely offer every food in this visual, but this categorizes them based on their energy density. And then ideally, we would include a protein and a fat source at every meal and snack. So we made a little chart here because we often get asked what are fat sources and what are protein sources. So these are some, there's more, but these are the most that we could think of. So we have our fat sources on the left and then our protein sources on the right. Some protein sources also are a source of fat, so some things overlap. But in general, you could look at adding a fat source and a protein source to that carbohydrate. That's that balanced plate that Katie talked about at the beginning. So here are some ideas, and you can kind of mix and match based on what your child likes to eat. And this is a nice picture we thought we'd put in of just kind of visualizing what some ideas are for fat sources. So oils, avocado, nuts and seeds, as well as we have the meat on there, which would be a protein source. And another question we thought we'd highlight in terms of kind of nutrition basics is, what about bad food? So this is a really common question. And our short answer is that all foods fit, and there isn't any evidence for a specific food that needs to be eliminated for children with cancer. And the exception for this is that there might be some suggestions by your child's dietitian if potentially they need to change something in their diet to help manage any complications of treatment in terms of nutritional challenges. And I like this picture here, which talks about yes to both the apple and the chocolate. So they're really, in terms of any specific food that's bad, there really isn't a bad food when it comes to nutrition. And this kind of talks a little bit more to this point. So, and something else to consider when we're looking at nutrition is that food provides a lot more than just nutrition. A lot of foods are traditionally labeled bad, do provide other values, such as bringing comfort or joy to children, maybe some family traditional foods that they enjoy, or foods that bring certain memories or certain positive experiences. So there's a lot more to food than just the nutrients that it provides. And at the very least, every food is still going to provide energy, which is beneficial for supporting weight and supporting growth. And now Katie and I will go over the nutrition challenges and the strategies that we have suggested to address them. So the first nutrition challenge would be nausea and vomiting. So this is something that's very common and can be a side effect of chemotherapy and radiation. It's often easier to prevent nausea before it happens versus treating it after it started. So your child's team might have suggested an antiemetic regime or a combination of antiemetics and for your child as a way to prevent the nausea and vomiting from happening, and they can also adjust it as needed. And here we have a lot of strategies. So our first strategy would be to avoid empty stomachs. So hungry stomachs can make nausea worse. And going off of that point, offering bland and starchy foods can really help to absorb stomach acid, which also helps children to feel better. So those are dry crackers, cereal, toast, as some examples. And you can offer foods that are easy to digest. So things like broth, clear liquid, soda crackers, rice, pretzels, dry cereal, digestive cookies, offering lots of fluid and ensuring your child stays hydrated, avoiding things like greasy foods, fried foods, spicy food, acidic food, sweet or strong flavor, strong odor foods for the short term. Serving food at a room temperature or colder can help, especially with foods that have a strong flavor or odor. Relaxing and trying to eat slowly as possible at meal times, and trying to offer small, frequent meals throughout the day versus 3 large meals. And our last tip is to rinse often, which can sometimes help with bad taste in children's mouth. Our next challenge is fatigue. So a common side effect, this is one of the most common side effects of cancer treatment, and it can also be worsened by inadequate energy intake, dehydration, and nutritional deficiencies. So some of the strategies here would be offering a wide variety of foods to your child so they can get both those macronutrients and the micronutrients, trying to get small, frequent meals throughout the day. So similar suggestion to if they're feeling nauseous. Having high energy, high protein foods. So again, having that small volume with more energy density can help, especially if they're feeling tired to eat a full meal. Having your child rest when they need to, planning activity for when your child has the most energy, and then speaking, of course, to your child's medical team. Constipation is the last challenge I'm going to go over, then Katie's going to take over. So constipation is very common in children, and it is very common with certain medications, as well as if your child has decreased fluid intake, decreased fiber intake, or decreased activity level. And constipation can lead to decreased appetite. So this is something to consider. And some strategies to help with constipation, which you may have already heard, are to ensure your child is hydrated, to offer fiber-rich foods, so whole unprocessed foods such as whole fruits, whole vegetables, oatmeal, flaxseed, chia seeds, legumes, and nuts and seeds. We recommend specifically kiwi just because it has its own unique a gentle laxative effect. So that might be something to try if your child likes kiwis. Encouraging gentle movement, and then ensuring your child has protected bathroom time, which means that they can have enough time in the bathroom, that they're relaxed and calm to try to have a bowel movement, as well as things like seating positioning. Something like a step stool or squatty potty can help. And also, of course, talking to your medical team about laxative options if needed.
Okay, so now on the other end of constipation, we'll talk about diarrhea. So this is again a common side effect of cancer treatment. And with diarrhea, you're losing a lot of fluids and electrolytes. So it's really important to prevent dehydration to ensure adequate consumption of fluids to replace any of that water or electrolytes lost. It's also helpful to choose or provide soluble fiber, which will help bulk up the stool and delay the time of digestion and stool output. So those types of foods with soluble fiber can include oatmeal, oat bran, barley, potatoes, rice, bananas, apples, and things like that. And then we also would want to avoid any kind of stimulants that could increase diarrhea output. So that includes things like juice, sweetened beverages, artificial sweeteners, and then any stimulants for the older kids that could potentially dabble in caffeine or alcohol. We'd avoid those as well with diarrhea as they can increase output. Okay, now mucositis is another common side effect of chemotherapy as well as radiation therapy to the oral cavity. So mucositis refers to those red or white ulcerative lesions, in the oral mucosa. And they can actually, mucositis can present throughout the entire GI tract. But of course, if it's in the mouth, that can impact oral eating. And so mucositis can be quite painful. And so the primary management strategy with mucositis is typically pain control as prescribed by the medical team. In terms of nutrition with mucositis, things like fluids and soft, cold, or cool foods that can almost be soothing on the oral cavity can be beneficial. So that can include things like oral supplements. We'll get a little bit more into that, but that may include Boost or Onshore, Pediasure, if you've heard of those, as well as anything kind of soft and cool, such as ice cream, popsicles, mashed potatoes, applesauce, smoothies, even cooled down soup and things like that. And we'd want to avoid any acidic, spicy, or salty foods when mucositis is present, just because that can cause some further irritation. Okay, taste changes. So this is another really common side effect of chemotherapy or radiation therapy to the oral cavity. And it's something that we see quite often. And I know it can be quite difficult for parents to be able to feed their child if they're finding some difficulties in terms of what foods their child likes and will eat. So the kind of main strategy here is really just trial and error. And so trying new foods and new tastes to see what your child may enjoy. So this can be a lengthy process as well, but I do just want to mention that with taste changes, taste buds do eventually regrow and will come back. It can take a few months, up to a few months max, for taste changes to continue to occur, but hopefully in time, taste buds return and taste and things go back to normal. But some strategies in the meantime, you can try bland foods as well as flavorful foods. So strong flavors like sour, tart, tangy, or salty foods. Textures such as crunchy, juicy, or cold foods. Small, frequent meals opposed to 3 big, large meals that can be kind of daunting with a child with taste changes and not very into a lot of flavors and textures just yet. You can also try adding different sauces and condiments to meals. If they like, say, barbecue sauce, for example, that tangy flavor, adding that to a lot of meals, if it helps your child be able to eat the meal, then that's totally fine. And lastly, metallic taste with meat is also common. And so with that, using plastic cutlery and avoiding kind of any use of metal or aluminum or metal-like things should help with that as well. Okay, and now appetite changes. So it is very common with children with cancer to have reduced appetite. Um, and so things that can help with that include small, frequent meals, energy boosting strategies. So those high energy, high protein foods that we previously mentioned. Um, and high energy foods. So adding sauces or oil or butter, cream, cheese, sour cream, etc. to meals and snacks to really increase the caloric content of the meal and snack. So if you're finding that your child is eating smaller quantities and smaller volumes than normal, then mixing in kind of an oil or butter to just get the calories up can be beneficial for that. Um, Also, high fat dairy products are much more calorically dense than, say, 0% or 1% milk fat yogurt or milk. So, try to shop for the high fat dairy products if you're trying to increase calories. And then nuts, nut butters, and seeds are also a great source of energy and fat and protein. So, you could try that as well. Next, there's oral nutritional supplements. So things like Onshore, Boost, Nutrigen Junior, Pediasure, those are basically a great oral supplement. They're kind of like a shake, or Boost is like a juice, and it has a great source of calories, protein, vitamins, minerals in there. So if you're finding that your child's intake is low, an oral supplement may help. They can sip on it between meals or with meals just to get some additional nutrition in. And lastly, for appetite changes, it is known that activity can increase appetite. So if it's possible to even go for a light walk or something like that, then that can also help.
Wonderful. So next, we're going to review nutrition therapy options. So there are lots of options when it comes to supporting your child's nutrition. You can always talk to their dietitian because they know them best, as well as you know them best, to try to figure out what support option might be best for them. And the nutrition therapy options are usually recommended for children who are having a lot of difficulty eating enough orally or meeting their needs orally. So some of the options that are commonly recommended would be, and we would recommend talking to your child's medical team about, might be oral nutrition supplements like Katie mentioned. So Onshore, Pediasure, Nutrigen Junior, Boost, there's a lot out there. So that can be a nice supplement to their diet. So in addition to their meals and snacks, a nasogastric feeding tube, which is a tube that goes through the nose into the stomach. That can be a really helpful bridge to nutrition. So it's usually short term, and it can help especially during more difficult times. If your child is having a hard time getting enough nutrition, it can be a really good support for them. And we do find that they're usually short term during different stages.
Okay, so next we're going to jump into some common nutrition myths and nutrition facts. And we just want to start out by saying that there is so much misinformation out there online and in the media. And so it can be kind of confusing to know what information to trust and what information to take as truth or to believe. And so it's just important to kind of make sure it's coming from a credible source and that it's backed by science. And so we're going to go through some of the myths that we often hear and hopefully provide some nutrition facts that help kind of clarify these things for you guys. So one that we hear a lot is sugar causes cancer, or sugar can increase risk of cancer or lead to cancer. And Navneet in the chat spoke to that a little bit there. She asked, where did the idea of avoiding carbs and sugar for cancer come from? So hopefully this slide helps answer that question. So the association between sugar and cancer is fueled largely by misinterpreted science. And the causes of cancer are complex, but we do know that the primary cause is genetic mutation. And so there are actually no conclusive studies that have directly linked sugar consumption to cancer. And so the body, it needs glucose to function, and all of our cells require glucose for energy. So whether glucose or whether you're eating carbohydrates, say it's a whole grain and a complex carb versus a chocolate bar, which would be a refined sugar, both in turn get broken down by the body into glucose, which our cells then use for energy. And so there's no real correlation between sugar consumption and cancer. But just of note that excess consumption of sugar, or any food for that matter, can increase weight and can potentially lead to obesity. And at that point, you are at greater risk of cancer. So the bottom line is that it's okay to consume sugar in moderation. It's definitely okay to consume carbs. Carbohydrates, our body uses for energy. So that's really important to not avoid carbs or cut those out. In terms of sugar from fruit and anything like that is totally fine. Refined sugar, like your sweets, candy, chocolate, and whatnot, that's also okay to consume in moderation. So I hope that helped to answer that question, Navneet. If not, feel free to follow up in the chat. But another one that we get a lot is individuals with cancer should avoid all meat. So I don't know if you guys have heard this one before, but this is a myth. And I just want to preface this slide by saying this slide can look a little daunting, and I don't want it to scare anybody from avoiding meat entirely or cutting it out. That's not the goal of this slide, and we'll get more into kind of the bottom line and the takeaway message in the next slide. And I also want to say that these studies are based on long-term data. So people that eat large quantities of processed meat over a long period of time. So having processed meat here and there is okay. So I just wanted to preface that slide by saying this, because I know this can sound a little daunting, but WHO, or the World Health Organization, which is what WHO stands for, has classified processed meat as group 1 carcinogenic to humans. So that means that there's sufficient evidence from epidemiological studies to support eating processed meat can cause colorectal cancer. And just to clarify what that means, colorectal cancer is cancer that stems from the colon or the rectum. So in terms of brain cancer or leukemias, there's no science that correlates those two. This study just saw an increased risk with colorectal cancer. And so processed meat includes salted, cured, fermented, or smoked meat to enhance flavor or improve preservation. And so examples of processed meat includes hot dogs, sausages, ham, corned beef, beef jerky, and all that stuff, all the good stuff. And then moving on to red meat. So WHO has classified red meat as group 2A, probably carcinogenic to humans. So that means that there's limited evidence from epidemiological studies showing a positive association between red meat and colorectal cancer. So they did see a positive association between the two, although the amount of studies that were done on this topic is limited. And so red meat includes things like beef, veal, pork, lamb, deer, horse, and all of those things. Next slide, please. So the bottom line here that I want you guys to take away from this, that red meat can also provide nutritional benefits. So it's a great source of protein, iron, zinc, and vitamin B12. And so a moderate consumption of red meat as part of a balanced diet is unlikely to increase cancer risk. So the main takeaway message here is to limit processed meats when possible. So just try to eat less hot dogs and sausages. You can still enjoy those in moderation, but just try to limit them where possible. And then in terms of red meat, you can continue to eat that in moderation. The Cancer Society recommends up to 3 times per week. And to choose poultry, fish, and plant-based protein sources more often.
So I'm going to go into our last myth. We were going to do myth or truth, but we realized all of the ones that we reviewed are myths. So this myth is fats and oils are bad for kids with cancer, which is another one we see a lot. So when it comes to fat or oils, fat is our friend when it comes to nutrition, despite previously held beliefs. There's a lot of benefits of fats. So some of them Katie highlighted earlier, protecting our organs and playing an important role in metabolism, hormone balancing, optimal brain function, and transporting vitamins. Some fats, such as omega-3 fats, are considered essential for us, which means our body cannot make them, and we rely solely on our diet to provide these essential fats. Omega-3s also uniquely help reduce inflammation in our body. Fats are an excellent source of long-lasting energy, and they're very tasty. And there is no evidence that we can go to the next slide to review the healthy fats that you commonly hear about. So oils, avocados and olives, fatty fish, nuts and seeds, and butter, ghee, and coconut oil. So the first few bullet points are examples of healthy fats. And the bottom is sources of saturated fats, which are sometimes known as unhealthy fats, but there is no evidence that including these saturated fats in moderation is unhealthy. It's just making sure that you have a balance of a variety of fats, which really helps contribute to the health benefits that we spoke about in the earlier slide. And the last thing that we want to talk about, and we thought we would get some ideas maybe at the end and brainstorm some creative tips to foster good nutrition throughout treatment. We tried to be as creative as possible here, but I'm sure many of you have thought of some creative strategies yourselves. So our top creative tips are oral nutrition supplements in 3 different ways, which we'll show you, spreads and sprinklings, which are ideas of how to add high energy, high protein foods, as well as crunchy combos for taste changes. So our first creative tip is trying an oral nutrition supplement in 3 ways. Especially if your child is having a lot of oral nutrition supplements, it can get really boring and they can get really tired of drinking the same drink. So we have 3 different ideas. So the first being trying to blend the oral nutrition supplement in a smoothie in place of milk or water. And we'll share a recipe with you at the end. The second idea is to mix whole cow's milk with the oral nutrition supplements such as Ensure. So you could do 75% Ensure, 25% cow's milk. For children that might find it too sweet or they don't necessarily like the taste, this can help them drink more amount. We recommend checking with their dietitian first and then make it into a pudding. So if you've heard of chia seed pudding, we have a picture of it there. You can chia seed pudding with one of the oral nutrition supplements, which we find tastes really good. Our next creative tip was the spreads and sprinkling. So this is ideas of how to increase the fats and the proteins. So the spreads are a lot of different fat sources. So butter or ghee, coconut or olive oil, hummus, avocado or guacamole, baba ganoush, cheese, like a ricotta spread or even a whipped feta can be easy to spread, cream cheese, nut and seed butter, full fat yogurt, mayonnaise or gravy, and then sprinkles. So things like hemp hearts, nutritional yeast, sesame seeds, sunflower seeds, pumpkin seeds, different nuts, as well as dried fruit, and then modify the nuts based on your child's age. So if they're under 4, they could maybe do nut or seed butter or even chopped up nuts or seeds. And this is a visual of what this looks like from Feeding Littles, which I really like. So just kind of how to visualize what this looks like. So instead of having a piece of toast with peanut butter, you could do a layer of coconut oil and then peanut butter on top of it. And instead of just avocado toast, you could do a layer of olive oil and then avocado on top of it. And the last example is melted butter or ghee and then cream cheese and fruit. And our addition to this would even be sprinkling something on top. So sprinkling chopped up nuts or seeds, sprinkling hemp hearts, and really in doing kind of these high energy, high protein ideas, you can help your child make the most of every bite because there's so much good nutrition and energy density in these foods. And our last creative idea is crunchy, fresh, and juicy combos for taste changes. So we tried to think of some unique combinations, and we'd love to hear if anyone has some unique combinations that their children like. So cucumber with Parmesan, almonds with red pepper and cream cheese dip, pretzels with apple slices and tzatziki, watermelon, feta cheese, and mint, as well as kiwis and walnuts. So this kind of combines a lot of those strategies Katie talked about earlier, about different fresh combinations with strong flavors, different juicy combinations with something crunchy. It's all about just mixing and matching and trying to find what your child might like. And this is the recipe, but you'll also have as well, because we're going to provide the slides. So this is our high energy chocolate banana peanut butter smoothie, which uses a chocolate. We use Entre a lot, but it really could be any oral nutrition supplement. And this is an example of how you can make a high energy, high protein smoothie. And that is all of our nutrition tips. We would love to hear any questions, comments, and answer any questions that you might have. And I see, we'll just talk about this before the questions, but that we have a great idea, but an oral nutrition supplement instead of milk for cereal. And I think that's a really good idea. And I will definitely keep that in mind.
Yeah, that's a great idea, for sure.
So I have some questions that we received prior to the presentation from some parents that submitted questions. And I'll just read some. Of course, if anybody has any live questions, please feel free to ask either on the chat or just turn your camera on and ask. So the first question was about picky eating after treatment. This parent's child has extreme sensitivity to food textures. They won't eat at mealtime and they graze throughout the day. So I guess they were asking about advice for picky eaters.
Okay, I'll take that one. So picky eaters after treatment is so common, especially if they're experiencing those taste changes and altered taste buds and whatnot. I just want to start off by saying that hopefully this improves with time and that their picky eating kind of resolves as their taste buds come back. But in the meantime, I know it's difficult, but I would say trial and error is really big. Trying to figure out what food selection your child does like. So trying new foods and new recipes and new flavors, and hopefully offering a variety of new foods can help kind of increase their repertoire of what foods they're willing to eat. Something else that might help include can include getting your child involved in the kitchen. So whether that's helping meal plan and choose kind of what recipe or dish they want for dinner that night, or actually helping out in the kitchen hands-on. And this can kind of give them a sense of if they help it, or they're helping out in the kitchen and making that meal, they may be more inclined to try eating it afterwards. Also, for the food textures thing, you can always try manipulating or cooking certain foods to change the textures. So different cooking strategies often result in different textures for certain foods. So whether you're baking, boiling, you can always saute foods and mix other ingredients in there to try to mask that one taste or texture. And you can also try mashing or blending. So blending different foods in smoothies or sauces, you can often kind of sneak in some good nutrients that way. And then with foods too, if you're finding they're picky and they don't like a lot of foods, if you want to try to reintroduce those foods, you can always try offering them in small amounts, one at a time, with other safe foods present, so foods that they already like, and that can be less overwhelming on the child. And then I think the last part of the question was also grazing and snacking throughout the day instead of eating structured meals. So I know that can be difficult to kind of change food behaviors and food schedules. And it might not happen overnight. It could be a gradual process, but really just trying to aim for that structure and offering 3 meals a day and trying to limit snacks throughout the day. So trying for 3 meals a day and a snack maybe in between each meal, and really just starting with breakfast. So having a good, healthy, well-portioned, balanced breakfast may help kind of set the tone for the day and help build that structure.
Thank you, Katie. Another question I just saw here on the chat from Sarah. What is a good meal or food to offer before fasting to help keep them feeling full?
Yeah, that's great question. And maybe Katie and I will both have tips for this one.
Yeah.
I would say a lot of what we talked about in terms of the high energy, high protein strategies would be really helpful in this situation. Especially, it sounds like if your child might be NPO or not eating for a period of time for a procedure or a test, having a really high fat meal will last them the longest time in terms of the different nutrients. So that would be my suggestion. And if Katie, you have anything to add?
Yeah, no, I agree. I was going to say high fat, high protein. Protein is often the slowest to digest in the body, so it can help them keep or help them feel fuller for longer. So those high energy, high protein, energy boosting strategies that we previously talked about can be helpful in this stance to help try to keep them full until they can eat again. So high protein, high fat, high energy.
Thank you. Another question I have here pre-submitted was how to strengthen the immune system. Any foods that help with immunity?
Julia?
Yeah, I can take this one. So it's a really good question, and I feel like it's a common question, especially this year. So in terms of immunity, there's no specific food or nutrient that boosts the immune system. There's definitely nutrients that support the immune system because there's different nutrients that are involved in our immune function. And in general, we kind of reviewed some of the macronutrients and micronutrients. If you follow a balanced diet, so if you get a wide variety of different foods on a weekly basis, it helps ensure that you're getting all those macro and micronutrients, which do in turn support your immune system. So really, it sounds simple, getting a balanced diet, drinking enough fluid, also spending time outside when you can be helpful. So there's really nothing that boosts the immune system, but you can definitely support the immune system by trying to get as much balance as possible.
Thank you, Julia. Another question here was, are there any foods or vitamins that help hair cells repair quicker? So when a child loses their hair from chemo, is there anything that can help it grow back faster maybe?
Yeah, so this is another really good question. And there isn't, from what we know from the research, there's nothing that would speed up that process, but absolutely trying to, similar to what Katie talked about glucose supporting cells. So all of the macronutrients are important for cell growth, and this would apply to hair. So just making sure that your child's getting enough energy throughout the day, especially those macronutrients like the proteins, fats, and the carbohydrates will help. Nothing that we know of will help speed up this process, but it definitely is important to make sure that they're getting enough energy throughout the day overall.
Great, thank you. I'll just keep asking some questions unless anybody has questions. You could put them in the chat. I am told any and all calories are good during chemo. Is this true?
That's another really good question that I can answer. So this is a common question, and I think this goes back to what we talked about with that all foods do fit, and all foods do provide value. So whether they're providing just calories, we're accepting that, and I think that's a positive, because at the end of the day, energy is really number one, and then we can focus on all those micronutrients afterwards. So definitely it does provide energy, which is a benefit, and then looking at how your child, what else is kind of benefiting your child from that food. So is it something that they tolerate really well and they know this food works really well for them? Then absolutely, it doesn't really matter what the food is. So there's definitely lots of values and things to consider. So I would say when your child isn't feeling well, there's absolutely exceptions that we're going to make sure that they're eating to feel good. And then if they are feeling themselves and they're feeling good and they're feeling like they want to eat, then we can focus more on that balanced diet. So it kind of changes based on how your child's feeling and the overall picture of how things are going.
Great, thank you. I have just a couple more questions that were pre-submitted. One was about sugar-free diet options. So I guess if a child is on a sugar-free diet, what options do they have for, I guess, making things taste better? Or what can they eat that's healthy?
Yeah.
safe?
Yes, yeah. So I guess my one question would be, why are they on a sugar-free diet? Whether it's a lifestyle choice, because of that previous myth that we talked about. So just important to keep that in mind. Um, or if it's because of hyperglycemia, and so that would be high blood sugar. So wanting to cut down on sugars for those reasons. So in terms of sugar-free diet options, I just want to note that sugar from fruit and complex carbohydrates are okay, and the body digests sugars from fruit and complex carbs much slower than refined carbohydrates. So it doesn't have the same impact on your blood glucose levels as eating, say, candy or cake or chocolate and those sugary sweets. So for that, I would say try to limit those refined sugars. So all of those sweets and treats and whatnot, to just a few times a week if possible, and treat them as a treat. And then sugar from fruit or whole grains and whatnot is okay. So I guess diet options is it's great to focus on protein and fat and whole grains and fruits and vegetables and part of that balanced plate, and then limit those refined sugars. And one more note on that as well, I would say with fluids, it's really easy to get a lot of sugar in the fluids that you drink. So juice, it would be recommended to limit to half a cup per day, and choose water as your primary hydration source.
Thank you. And I see we have another question from Sarah. Thank you, Sarah. She says, when my child is on steroids, she will get fixated on one specific food. It is very hard to get her to eat other foods. Any tips for when kids are on steroids, or just let her eat noodles for days?
This one can be tough. I know when kids are on steroids and they have kind of an increased appetite, and yeah, they get fixated on what they like and what they want. And so it can be difficult to reintroduce a variety of foods. And so I would say try to sneak in some other nutrients here and there if that's possible. For example, if she's really into noodles, I don't know if she likes to have a sauce with her noodles, but if you're, say, making a homemade sauce and she likes pasta, you can always try to blend in some vegetables into a pasta sauce and just sneak them in there, and hopefully she doesn't taste it or notice it. And putting in kind of spices and whatnot should hopefully mask the taste. And you can always kind of get creative in those senses to sneak in extra foods that have great nutrients if they're fixated on one or the other. You can also offer like a small portion of another food along with the noodles, so you're not refusing noodles altogether and trying to get her to eat something else entirely. So she still has that food that she likes there for comfort, and then adding some small portions of different foods on the sides. And even if she just takes a couple bites, that's okay. And hopefully in time, we can work back to that balanced diet. And sometimes a short-term, like if she's just eating noodles or she doesn't have much balance for a short period of time due to medications that she's on, that's okay too. And just about working towards more of a balanced diet in the long term.
Yeah, definitely. The only thing, those are all great suggestions. And the one thing I can think of too, and noodles we can use as a specific example of maybe trying foods that are the same but different. So an example of this, if she likes wheat noodles, you could try rice noodles and tell her these are noodles, but these are rice noodles. There's also now like chickpea noodles, black bean noodles. So if that's maybe the way that she wants to get variety, if she likes the texture and the whole meal, that might be something to try too.
Great suggestions, thank you. The last question I had that was pre-submitted was, it just says weight loss nutrition ideas. So I'm not sure if that means for weight loss or to prevent weight loss. I know you already had in your site some great ideas on how to add more calories and fat for those children that aren't getting enough. Maybe on the other side, if the child is overweight, maybe they're talking about weight loss ideas that are healthy for a child.
Yeah, so that's a great question. And I think there's kind of two sides of that. Like you said, we did talk about weight gain, which is sometimes it ends up being a big focus. And then there's the whole other end of the spectrum where sometimes kids, even like Sarah mentioned on steroids, it can affect your appetite. And sometimes kids will have more rapid weight gain. And what do you do at that point? So the first thing I would say, definitely to talk to their medical team. Weight loss isn't necessarily something that we would focus on for kids, but it's more just looking at, is there a big change that they made and how can we help support them making healthy changes kind of long term? So there's no diet that we would ever put a child on, but more looking at how can we support their appetite? How can we support them having healthy eating behaviors? So some ideas for this would be actually similar to the picky eating suggestions of having your child get involved at meal times if they're able to, or if it's not at meal times, maybe it's in meal selection. So if they can get involved in that way, maybe looking up learning about food online as well as an option. Also, back to our balanced plate. So ensuring that they're getting their balanced plate at meals and snacks, the same concepts would apply, making sure they're getting activity as they're able to, resting enough, being hydrated. And the other suggestion would be also making sure that they're mindful at meal times. And there's some strategies around this to help make sure that they're in tune with their body. So this means that they're able to listen to their body's natural hunger and fullness cues. So understanding when they're full and their body's done eating, and also understanding when they're hungry and when they need to eat. So children do have the natural ability to do this, but sometimes it takes some time to get back to that place. They're able to naturally regulate their appetite. A lot of times it's just going to take a little bit of time and just kind of supporting them along the way.
Thank you. Any other questions, live questions from our attendees now? If not, if you think of another question after, you can email, I'll just have our email address and then I can forward it to Katie and Julia if you have a pressing question on nutrition. It's info@opac.org. And I will share the slides and the recording of the presentation. I'm just typing in here my email as well on our website and our social media pages. So it'll all be on there for everybody to see. Navneet has a question. What do you think about getting electrolytes from drinks like Gatorade?
I would say, well, Gatorade, it does have electrolytes to help replenish those, but there's also a lot of sugar in Gatorade, so not your ideal hydration source. In terms of, I would just be curious if they're losing high output, let's just say if they have diarrhea and you're trying to replace those electrolytes lost, then I would say primarily water for hydration is great. And the body's really great at regulating electrolytes as well. So unless the medical team has noticed any discrepancies in blood work in terms of low electrolytes and whatnot, then it should be okay to just drink water and eat enough food as well, because there's electrolytes and those micronutrients in the foods that you eat. So I'm not saying never have Gatorade. That's totally fine to have that in moderation as well. It just does have a lot of sugar in it as well. So just be cautious in the amounts that you're drinking.
Thank you. So I'm just buying time, but if there's no more questions, I just want to remind everybody, we do these monthly presentations, OPAC does, at the last Wednesday of every month. And so keep up with our emails and our social media accounts to check on those. And we also have our weekly drop-in support sessions with our parent liaisons every Tuesday at 7:30 on Zoom here. So you can get our the link to that if you're already subscribed to our emails. And you can check our website at opac.org for more information. And I just want to thank Julia and Katie so much for an excellent, informative presentation on nutrition, a very important topic for our families. And again, if you have any other questions for them you can think of after, just email info@opac.org, and I'll make sure it's passed along to them, and we'll be sharing the presentation slides and the recording on our website and social media as well. So thank you very much. Thanks everyone who came to join us tonight as well.
Thanks so much, everybody. And thank you, OPAC, for having us and allowing us to present on this topic. We really enjoyed it. So thank you for everyone for attending. Yeah, this was great. Yeah.
Awesome. Yes. Thank you so much. This was so fun. And we really appreciate this opportunity to talk to everyone.
Thank you, everybody. Have a good night.
Thanks, everyone. Hope this
Thank
was
you.
helpful.
Bye.
Bye.